Okay, so thank you for joining me for this session today on Oral Health 80/20, Healthy Aging, Happy Aging. So as you all know, Singaporeans are among the longest living people in the world. So who here wants to be able to enjoy the food that they love, like, chili crab, laksa, and age gracefully with confidence? I'm sure all of you would like to. So today, I'll be sharing with you the concept of 80/20, which refers to maintaining at least 20 teeth at the age of 80 years and beyond, so that you can eat well, speak well, and smile with confidence. So globally, it has been found that oral diseases affect 3.5 billion people worldwide. So today, we stand at 8 billion people worldwide. So what this means is that about 1 in 2 person actually has some form of oral disease, such as tooth decay or gum disease, which are the major causes for tooth loss. So an adult with a full dentition has 32 teeth, including the 4 wisdom teeth, which you heard about in the talk earlier today. So can anyone hazard a guess what is the minimum number of teeth a person should have for good function? Well, studies have shown that the minimum number of teeth for good function is actually 20 teeth, and this is actually based on the shortened dental arch concept. So what this means is that having 10 upper and 10 lower anterior and premolar teeth that are biting or in contact with each other. So with at least 20 teeth, you will be able to eat, chew, and enjoy almost any types of food regardless of the texture. So how does Singapore fare in terms of the 20 teeth concept? A local study on the oral health status of 5,000 community dwelling Singaporeans found that the average number of teeth and the proportion of people with at least 20 teeth actually decreased with increasing age. So for those 80 years and above, only 9.1% had at least 20 natural teeth. And in this study, what they also found was that 31% of this 5,000 Singaporeans actually did not have any teeth. And of those who didn't have any teeth, 30% did not have any dentures. So having poor oral health can actually result in tooth decay and gum disease, which are the leading causes of tooth loss. So what is the impact of tooth loss? So basically, if you have extensive tooth loss without replacement, this can actually impair a person's chewing ability and leading to nutritional issues such as malnutrition. So a study done in Japan actually found that tooth loss resulted in changes in a person's nutrition, with those who had at least 25 teeth or more having a higher intake of dairy products as well as brightly colored vegetables, whereas those who had less than 20 teeth actually had higher intakes of rice and confectionery. So people with extensive tooth loss are more likely to substitute food high in vitamins and fibers for food that are rich in carbohydrates and fats, as people who have less teeth may experience some difficulty chewing certain food groups like vegetables. Tooth loss also affects how a person speaks. So for example, a person who has extensive tooth loss without any denture or has an ill-fitting denture may not be able to pronounce words clearly for others to understand them. So this can actually lead to embarrassment and may lead to a person limiting his or her social interactions. Not having any teeth can also affect a person's physical appearance and self-esteem, especially if these missing teeth are their front teeth. So this can actually lower a person's quality of life and lead to loneliness, social isolation, especially in the elderly. So there's actually also increasing evidence linking poor oral health to systemic diseases such as diabetes and aspiration pneumonia. So take the bidirectional relationship between diabetes and gum disease, for example. So diabetes has been found to be a major risk factor for periodontitis, which is the severe form of gum disease. So the susceptibility to periodontitis is increased by 3-fold for people with diabetes. Similarly, if you have untreated periodontitis, it can also negatively affect the glycemic control in a person with diabetes. So to put it simply, your oral health is a window to your general health and well-being. So if your oral health is in tip-top condition, your body will likely to follow suit. So hence, it is important to maintain good oral health throughout life. So poor oral health will also lead to a decline in oral function. So this is actually known as oral frailty, and this can actually affect a person's ability to chew, swallow, and speak. So this oral frailty is contributed by 6 domains, and this includes the number of natural teeth, the chewing ability, swallowing ability, oral musculature, speech, and oral cleanliness. So of these 6 domains, the number of natural teeth actually plays the greatest impact in terms of oral frailty, because it also influences whether a person is able to chew, swallow, and speak normally. So oral frailty has also been found to strongly predict for the onset of adverse health outcomes, which includes physical frailty, sarcopenia, disability, and mortality. So as such, prevention of oral frailty is essential for healthy aging. So how does one prevent becoming orally frail? So this actually boils down to maintaining good oral health to prevent oral diseases. So periodontitis is commonly known as gum disease. So this is inflammation of the gums that can actually lead to bone and tooth loss. So over time, the bacteria and plaque actually builds up and causes the gums to become inflamed. So some signs that you might have, the early signs of gum disease would include redness, swelling, and bleeding gums. So this is termed as gingivitis. So if gum disease is left untreated, it can actually progress to what we call periodontitis, which is the advanced stages of gum disease, where you can start noticing that you have gum recession, the teeth start looking longer, you have bleeding gums, and then the teeth also start getting shaky. So the main reason for gum disease is the presence of dental plaque, which is the yellow biofilm or soft deposits that you can actually scrape off your teeth. Of course, there are other factors that can also contribute to periodontal disease, which includes smoking, diabetes, having poor diet, as well as some medications, as well as genetics. So how does one prevent periodontal disease? So having good oral habits, such as brushing at least twice a day, using interdental aids, such as flossing, as well as the interdental brush, and visiting your dentist regularly will actually help to prevent gum disease. So another oral condition that actually contributes to tooth loss is tooth decay. So sugar itself actually doesn't cause tooth decay. In fact, whether a person has tooth decay does not depend on the amount of sugar that one consumes. So that is related to obesity, okay, but rather how long the sugar stays in the mouth. So there is actually also an element of time. So if you eat a lot of carbohydrates, sugars, okay, and if you don't clean your teeth properly, the dental plaque actually can build up and form a breeding ground for acid-producing bacteria inside your mouth. So if this sugar stays longer in your mouth, the bacteria in dental plaque actually has more time to use these sugars to break down to form acid. So the more it produces acid, the higher chance that you will have to get tooth decay. So whether a person has tooth decay or not actually hangs in a delicate balance. So you can see to the left, there's actually pathological factors, which includes acid-producing bacteria, frequent consumption of carbohydrates, as well as a salivary flow and poor oral hygiene. And then to the right, you actually have protective factors, which includes good salivary flow, because this helps with the clearance of food, fluoride in your toothpaste, as well as good dietary habits like the consumption of fruits and vegetables, and good oral habits. So what this means is that you actually don't have to avoid carbohydrates. You just have to make sure that your mouth is thoroughly clean on a regular basis, so that the plaque in your mouth is kept to a minimum. You can also counter bacteria through proper brushing, flossing using a fluoride toothpaste, as well as having good dietary habits, such as not snacking frequently in between meals, and reducing simple sugars such as soft drinks in your diet. So key messages from the sharing today will be that good oral health actually contributes to good general health and healthy aging. Maintain at least 20 teeth at the age of 80 years and beyond for good oral function. Of course, prevention is always better than cure, so it's important to have good dental and dietary habits and to visit your dentist regularly so that your teeth can last a lifetime. So thank you. So with that, I'll be happy to take any questions.